giving us knowledge, opening our eyes, created awareness, and we are truly grateful, truly thankful. For those of us who just tuned in, you're late but not too late, because we are going to do a quick wrap. Could you, Kelvin, just give us a short summary of everything we've discussed so far, and then we can have our take-home messages for our listeners?
Yeah, and Dr. Sanaa to talk about hypertension or high blood pressure. Today we have discussed what hypertension is. You're having high blood pressure. Chede moja na for winter no mono. Speed no na issue. So if it continues like that, then it damages your organs. Botuma hawa koma, kidney, drain. It can cause irreversible damage. And so because of that, you have to know your numbers, know what your blood pressure is, check your blood pressure regularly. And then we mentioned that the normal blood pressure, 120 systolic on 80 diastolic, or anything less than that without symptoms is okay. Once she starts recording BPs above 120, 80, above 130, 80, above 140, 90, that's concerning that you actually have established hypertension, and then you need to see a doctor to help sort that out for you. We also talked about the risk factors for developing hypertension. We talked about modifiable risk factors and non-modifiable risk factors. So your age, the older you are, the higher your risk, your race, being African and black alone increases your risk of developing high blood pressure. Your family history, if there's a positive family history of hypertension, then there's a high risk of you developing hypertension. If you are male or you're a man, you have a higher chance of getting hypertension compared to a female. We also talked about modifiable ones like your diet and your lifestyle, your diet. So foods that contain a lot of salt, a lot of fat, oils, all this can increase your risk of developing hypertension. Chronic stress is also a big risk factor. Alcohol use, smoking is a big risk factor for developing hypertension. Obesity, like being overweight, is a risk factor for developing hypertension. And these are things you can work on if you notice you have any of that. There are other things too that can contribute to hypertension. We talked about secondary hypertension. We mentioned that about 90% of people that have high blood pressure or established diagnosis of hypertension, we don't know the identify. There's no identifiable cause. We don't know the cause. But for about 10%, it is secondary, related to kidney disease and other hormonal issues like thyroid conditions. And we also talked about sleep apnea, obstructive sleep apnea. Yes, and then
Gofa was not.
or there was no also, and then
Mm,
word that they have pauses in their breathing whilst they are sleeping.
okay.
They also need to check that out. And why is it important to know your values? Why is it important to know your blood pressure values? Because of the complications of high blood pressure. Because high blood pressure can affect your brain, it can affect your heart, it can affect your kidneys, it can affect your eyes. So you need to get screened. You need to know your value so that you prevent these complications. How does it affect your brain? You can develop a stroke. How does it affect your heart? Your heart can fail at pumping. How does it affect your kidneys? You can develop very bad kidney disease. You end up needing a kidney transplant or dialysis. How does it affect your eyes? You can have blurred vision, and your vision is all distorted because you have high blood pressure. So it's really important to know your numbers, know the complications, and the management. How do we manage high blood pressure? We start with non-pharmacological management. By that we mean um, measures not involving the use of drugs. So your lifestyle, you need to modify your lifestyle. Check your diet, low salt diet. You need to take fruits, vegetables, um, whole grain cereals. Um, you need to exercise. So physical inactivity is a risk factor. So we are saying that 30 minutes a day, at least 5 times a week, is good enough to help keep you in good shape. You are obese, you need to lose weight. Um, yeah, you need to manage your stress levels, reduce your alcohol intake, quit smoking if you are into smoking. Um, just to mention a few. And one thing you must know is that once you have that diagnosis, primary hypertension, you know that there is no cure, but it can be managed. And so your medications or whatever treatment your doctor puts you on is lifelong. Um, yeah, so this is just a quick wrap, Doctor.
What has been discussed so far, but I'll just add that remember that it's a silent killer, so you should be conscious about your own blood pressures. Regularly check your blood pressure and remember your family as well, especially your parents, grandparents who may be old and frail at home. Just keep an eye on them, make sure they are taking their medications, they are complying to whatever regimen the doctor has put them on. They are regularly going for their visits. If it's you yourself, you're regularly going for your checkups so that if there's any change in your medication that has to be done, it's done for you and your blood pressures can be controlled throughout.
Thank you, Dr. Kelvin. Thank you, Dr. Sharon, for granting us 2 hours of your time. I know you have busy schedules. Listeners, remember hypertension can be controlled. It cannot be cured, but it can be controlled. So know your numbers, check your blood pressures regularly, okay? Eat smart, move well, move around and move well, okay? Rest well and take your medication if you've been put on it. Thank you so much. Have a good afternoon. It's